guys, welcome to my channel. This is the part 2 video of the forearm anatomy, and this time we talk about the posterior compartment. So posterior compartment has superficial muscles and deep muscles, and superficial muscles are the 7 muscles. Don't forget that. The first one is the Brachioradialis. The origin is the lateral supracondyle ridge of the humor. Insertion is the styled process of the radius. And nerve supply is the radial artery. Insertion is the styled process of radius. And nerve supply is the radial nerve. Radial nerve. And blood supply is the radial recurrent artery. Remember, we have 3 radial. And the function is the Pollicis elbow. And then next muscle is the extensor carpi-radialis. Longus origin is the lateral supracondyle ridge, and insertion is the secondary base of the metacarpal. And the nerve supply is the area nerve supply, radial artery. Function is the extended and abductor of the wrist. And the next muscle is the extensor carpi-radialis brevis. The origin is the lateral epicondyle, not supra. This is the epicondyle. Extensor carpi-radialis longus origin is the supracondyle, but this is the epicondyle, and the insertion is the base 30 metacarpal. Don't forget, longus is the secondary base, and the brevis is the third base. And nerve supply is the deep branch of the radial nerve and blood supply is the radial artery. Function is the extended and abductive of the wrist. They have a same function. And another muscle is the extensor digitorum. Extensor digitorum origin is the lateral epicondyle. Don't forget. Extensor digitorum, extensor carpi-radialis brevis, they come from lateral epicondyle. And insertion is the expansion of digit 2 to 5. Digit. This is the digit. So 2 to 5. And nerve supply is the posterior interosseous nerve, and blood supply is the posterior interosseous artery. The function is the it's extended fingers 2 to 5 and assist wrist extension. This is the main function. This is the assist only. Another muscle we talk about is the extensor digitorum minimi. Don't forget, if you see minimi, it is so origin is the lateral epicondyle. Insertion is the extensor expansion of the 5th digit. If you see minimi is this digit. And nerve supply is the posterior interosseous nerve. Blood supply is the posterior interosseous artery. The function is the extended little finger. Minimi is the little finger. Don't forget that. And another muscle we talk about is the extensor carpi ulnaris. Origin is the lateral epicondyle, posterior border of the ulna. Lateral epicondyle and posterior border of the ulna. Insertion is the base 5 metacarpal. Base 5. Still is the minimi. Blood supply is the posterior interosseous artery. Nerve supply posterior interosseous nerve, and function it's extended and abductive. Remember, we have muscles that abductive. The abductive is the abduction is the extensor carpi-radialis, longus and brevis, but abductive is the carpi ulnaris. No, don't confuse. I'm telling you. Carpi-radialis, abductive, but extensor carpi ulnaris is adductive. Memorize that. I know your professor loves this. And another muscle we talk about is the Anconeus. The origin is the lateral epicondyle. This is the Anconeus, lateral epicondyle. And the insertion is the olecranon and upper posterior of the ulna. Upper posterior of the ulna. A nerve supply, of course, is the radial nerve, and the blood supply, middle collateral artery. Function is the assist the elbow, because this is the elbow. Assist the elbow extension, stabilize the elbow. And we talk about deep layer. The deep layers have 5 muscles, and the first muscle is the supinator. The origin is the lateral epicondyle and supinator crest of the ulna. This is the lateral epicondyle. This is the supinator crest of the ulna. And insertion is the upper side of the radius. And nerve supply is deep branch of radial nerve, and blood supply is the radial recurrent artery. And function, of course, supinator is supinate of the foramen. Don't forget that. And another muscle we talk about is the abductor pollicis longus. Origin posterior radius, posterior ulna, interosseous membrane. Okay, the origin is the posterior radius, ulna, and interosseous membrane. And insert is the fasty base, fasty metacarpal. Oh God. And nerve supply is the posterior interosseous nerve, and blood supply is the posterior interosseous artery. The function is the abducti. Remember that, abducti and extend the thumb. The insertion is the thumb, and the function is the abducti and extend of the thumb. The only function he has. And remember, when you see Pollicis, remember it is the thumb. When you see Pollicis, it is the thumb. When you see Minimi, it's the little finger. Don't forget that. And another muscle we talk about is the extensor Pollicis brevis. The origin is the posterior radius interosseous membrane. You see the and insertion is the base of proximal phalanges of the thumb. Oh God, we have 2 muscles that insert the thumb. The first one is the abductor pollicis longus. It abductor of the thumb. The next is extensor pollicis brevis, and it extend the thumb at the metacarpal joint. And of course, the nerve supply is posterior interosseous, blood supply is the posterior interosseous. Don't forget that. And another muscle is the extensor pollicis longus. Still, we are in a thumb. The origin is the posterior ulna interosseous membrane. And insertion is the base of the distal phalange of the thumb. Oh God. Okay. Origin, insertion, and blood supply is the posterior interosseous artery. A function is extended the thumb interphalangeal joint. Finally, we talk about extensor indicis. This is an indicis. So if you hear indicis, this is the indicis. So origin is the posterior ulnar interosseous membrane. And insertion is extensor expansion of the indicis of the indicis finger. And nerve supply is, of course, posterior nervous, and blood supply is the posterior interosseous artery. The function extendi and extendi the indicis finger. Don't forget the extensor extendi. The abductor abducti. Don't forget that. And bye.